This is Dr. Silvester from Next Step Foot and Ankle Clinic. Thanks for listening. I'm going to talk a little bit about heel pain, plantar fasciitis today. First of all, we get a lot of patients that have had plantar fasciitis repetitively over the years, or they've had heel pain. We like it when I see a patient that they come in and say, well, I have plantar fasciitis. I ask them, don't tell me your diagnosis, tell me your symptoms. Because there are several things that can cause heel pain, and not all of them are plantar fasciitis. That's one, I see this mistake all the time with practitioners where a patient's been treated for plantar fasciitis and they actually have the wrong diagnosis. Actually when they come in, if you look carefully at them, there's another pain generator, and you need to kind of address that if you're going to be successful in treatment. But let's just talk about plantar fasciitis to try and limit the scope of this video. So, initial treatments for plantar fasciitis when a patient comes in. Generally first of all, what it is it's sort of an inflammation if it's early, or if it's been there for a long time, it's maybe a degeneration of the ligament on the bottom of your heel. Treatments that if initially would be like a steroid injection, oral medication, and I think an arch support is very critical in the treatment of plantar fasciitis for most people, depending on the foot type. Sometimes a night splint can be helpful, but those are kind of the baseline. Everybody does those treatments, and they work probably 50 to 60% of the time. And they may or may not have what we like to say has legs. That means, is it going to stay healed? Depends, you have to kind of follow patients with plantar fasciitis for a long time. But secondary therapies, let's talk about the patient that fails on. So now you've got this patient that's had plantar fasciitis for 6 months, and they really aren't getting better. So the next therapy would be what we like to call orthobiologic therapy. We like to use an ultrasound to diagnose plantar fasciitis. We consider it kind of critical in the assessment of plantar fasciitis, because if you actually look at the structure with an ultrasound, they are very distinct, very well defined, medically proven, peer-reviewed journals of what the changes are in the plantar fascia that indicate that it has plantar fasciitis and the degree of severity. So, let's say you have a patient like that. Then you've got a real thick, hypoechoic, which means dark, which either means degenerated or inflamed, plantar fascia at the insertion. You can inject that with PRP. There are several studies that show that PRP is very effective. We like to use bone marrow aspirate as well, where we pull the blood out of your bone because there's more stem cells in bone marrow aspirate, and we re-inject it into your plantar fascia. We do that under ultrasound guidance to make sure we get it in the right spot. Shockwave therapy. There's more level 1 evidence for shockwave therapy than any other treatment for plantar fasciitis. But you have to understand that these things are a process. See, like when you get a steroid shot, you expect to feel better in 3 or 4 days, sometimes 2 days. That's not the way it is with the shockwave therapy and PRP injections. These are healing the damaged tissue. It's a completely different paradigm than just treating inflammation. So you've got this damaged, degenerated tissue. You're trying to restore it back to its normal state. So it's sort of restorative medicine is what we like to call it. So same things all apply. You want to use an arch support. You want to maybe use a night splint. You certainly, if you're doing shockwave and PRP, you don't want to take any anti-inflammatories or steroids and even turmeric. You want the body's own inflammatory system to happen, because that's part of the healing process. And as you treat the patient over time, you generally do 3 sessions. Sometimes you have to do 6. And if you have to do 6, do 6. But the sessions, again, this is a process to get the tissue to heal itself. Latest research in shockwave therapy is that it almost always works if you use it long enough. Now, the other thing you have to remember with shockwave therapy is once the therapy is done, you don't evaluate the effectiveness of that for about another 3 to 4 weeks, because the tissue is healing. We also at our clinic use a lot of other things like nutritional substitution. We use different things to help the ligament heal with nutrition. We also use some little tricks that I'm not going to talk about on this video because I don't want other people to do them, to help stimulate the circulation in the plantar fascia. But then there's still a group that fails. In that group, then you have a couple options. One is a percutaneous plantar fasciotomy. That's something we just do primarily under ultrasound guidance. We just make an incision about this big. We look at the plantar fascial ligament, we release it with a little tiny blade. It has a 74% success rate in the journals. It's not 100%, but it has a very quick little recovery. We also put people in a cam walker for about 3 weeks when we do that, and they have to use that at nighttime. What a cam walker is, it's a Velcro on boot. The reason you want to do that is so that the ligament heals in a lengthened position. Then there's an open plantar fasciotomy. And so if you do that, that's an incision about this big on the bottom aspect of the foot. You can take a piece out of the plantar fascia. That has a very high success rate as well. So that's sort of I guess you would call it the tree of treatment for plantar fasciitis. Most people respond to the initial treatment very well, and they don't need to go further. But depending on the severity and the recalcitrant nature of the disease, it depends on how far down that treatment tree you go. Anyway, so that's sort of my summary for plantar fasciitis. I hope that's helpful. If you have any questions about that, please make an appointment with us here at Next Step Foot and Ankle Clinic. Thank you.